Solutions webinar. Today we're going to be presenting the real-world impact of NextGen 591-841 from a beta client perspective. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Attentive. I'd like to take a moment to explain the process for today's presentation. First, I would like to mention this webinar will be recorded. We'll send out a copy of the slides along with the recording later this week. Next, for those of you who aren't familiar with Attentive, I want to share a bit of who we are with you. We specialize specifically in NextGen healthcare, and we're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen. And we also have two add-on productivity solutions for NextGen, CheckGuard and Refund Manager. Next, I wanted to mention some upcoming webinars that we're going to be presenting. On July 11th, we'll be presenting Transforming Patient Access to Healthcare Using Telemedicine. In it, among other things, we'll provide insights into strategies on how to integrate telemedicine into your practice, including setup, coding, and even gaining physician buy-in. And on August 1st, we're going to be presenting PCMH, all the questions you've asked, answered. We'll be sending out an invitation to those as we get closer to the webinars, or you can register directly on our website on the Events and Education page. Okay, so back to today's webinar on NextGen 59841 from a beta perspective. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Adam Boron is Solutions Manager at Attentive, Lindsay Lanning is our Healthcare Compliance Consultant, and Lexi DePasquale is one of our Senior Consultants. Adam and Lexi have both been working on-site with our beta clients, so they know 591-841 in and out and through and through. So Lindsay, the webinar is all yours. Feel free to get started when you're ready.
Great, thank you, Chelsea. Well, hi everyone, and thank you for joining us for our webinar, The Real-World Impact of 591-841 from a NextGen beta perspective. As we know, NextGen versions 591-841 are here, and we want to be the first to tell you about it from real-life experiences as a beta partner. We want to share with you real insights into how these new features and added functionality affect your end users. So yes, we will provide you with a new feature overview, but we will take it a step further and include client feedback and our lessons learned from this specific upgrade. So we're really stepping into your shoes and examining the upgrade from a client's perspective, as well as covering some issues we encountered in hopes to help you avoid them. Our goal really is to just share our expertise and experience with you to minimize, hopefully, your frustrations and maximize your success with 591-841. So up first on our agenda today is just introducing you to Maternal Ohio Clinical Associates, since they are who we partnered with for the beta upgrade. Next, we will provide you with a new feature overview for EHR, PM, and even some specialty-specific changes that may impact your practice. But again, like I said, we did take it a step further and included feedback from MOCA on their thoughts and experiences using these features so far. And lastly, we will highlight the roadblocks we encountered with the upgrade. There really are only a couple, but we want to share them with you now so you know what to expect. So like I said, we know the newest version of NextGen's enterprise and clinical templates, as they're calling them now, are now in general release. So the versions are enterprise, PM, EHR 591, and clinical templates 841. So, and in NextGen's words, this new version has new and improved functionality to create a better user experience. But who does this upgrade affect? Even though it is an upgrade and not a full-on implementation, this still affects the setup team, focused on file maintenance and system practice templates that may need to be configured, etc. Not only them, but also your management team to realize the training and preparation required to be ready for the new features and enhancements, as well as the obvious billing and office staff, as well as providers and clinical staff, who will need to determine and understand the changes that will impact their actual workflows. So who is Maternal Ohio Clinical Associates, or MOCA? Well, in short, they are a fairly large women's health entity with over 40+ providers and mid-levels, and they have practice locations in Central and West Central Ohio. Again, just wanted to give you this really brief background on this practice, since we really centered this presentation around features that they utilize and they found helpful. Like I said, I did include some other specialty-specific features at the end of the presentation as well. Now, not only will we look at MOCA's beta process, but also analyze how does the beta process work in general. Well, to start, NextGen selects a handful of clients who are willing to actually work one-on-one with them, testing new functionality for both EHR and EPM. So let me mention it again. This involves a ton of testing. Also evaluating the end user experience at the same time and providing recommendations and valuable feedback. So how this works, like I said, is through continuous testing, but also constant communication. Constantly relaying what's working or what's missing, what's wrong or what's good. It really is about collaboration on both sides to make sure this version is getting better before general release. Now, since we partner with MOCA for the beta testing process, I kind of actually performs the testing with MOCA. We also submit tickets to document issues and errors. We then have bi-weekly meetings and hot fixes that have to be applied throughout the term of test. Once the version is put into beta production, the process continues all the way through to general release. And then when the final GR version is released, that is also put into prod. I will say that by committing to be a beta partner, you are vowing to follow through with these hot fixes and ultimately the upgrade. The only real reason to back out is if there's a patient safety issue that's been identified. Now, if we look at this upgrade in particular, it went extremely well. We went back to MOCA front office and clinical staff and received the following feedback. They said it was a smooth upgrade with no system interruptions. Providers and front office staff experienced almost no performance issues, which, again, like I said, hasn't been the case in the past. But this upgrade really did flow seamlessly. New features were being used by the practice on day one. The sensitive encounter functionality, which we'll look at later on, was utilized the day of go live. And overall, there was a sense of recognition with new features and standardization, saying that the last two upgrades have demonstrated how seriously NextGen is taking our request. So as you can tell, just some really positive feedback and comments from the offices overall. The benefits we saw for participating in beta, as well as those pointed out by MOCA, is having NextGen involve practicing physicians, nurse practitioners, and other clinical staff in KBM and core application content development. It really offers them the opportunity to have their voice heard and be a key player in helping shape the future of NextGen and really act as an instrument of change. And now Dr. Bell is actually a practicing physician at MOCA, and he took the time to sit down with me and really put into words his experience with not only the beta process, but the 591 upgrade as well. He stated that testing offers a direct link or relationship with NextGen, saying that issues are fixed as they're reported. There's really no lag time since tickets go right to developers and they're addressed quickly. And this actually allows the user to see results and changes bi-weekly. He personally believes this is a great way to have a positive impact on the end product, while also allowing clients to experience an unparalleled relationship with NextGen. It personally left him and his staff with a greater respect for NextGen, trying to accommodate everyone's needs. He actually said he gained an appreciation for the time commitment it entails, and it reassures providers that they have vested interest in users. He went on to say there is a tremendous benefit in shaping and molding the product to increase efficiency and reduce clicks, and that by participating in beta, specifically the 591 upgrade, it really worked to combat the "what provider ever looked at this" mentality often found in practices. So again, like I said, just really positive feedback overall. All right, I do feel like we've been going on and on about how great this upgrade has been for MOCA, and we've been gushing about the new features it entails, so I'm going to finally hand it over to our NextGen expert and consultant, Lexi, to walk you through both the EHR and PM features found within the 591.841 release. So Lexi, it is all yours.
Okay, thank you, Lindsay. So as promised, I'm going to be walking you through the new features that you will find if you do upgrade to 591.841. So we're going to go ahead and get started by looking at some of the new enhancements in regards to the EHR. Okay, so there have been several enhancements with this upgrade regarding the inbox. So one of the first enhancements is the ability in our patient portal to accept, release, reassign, and forward messages that were sent to the patient portal through a distribution list. So basically with this distribution list, an example of this could be, let's say a patient is sending a message through the portal and it is given to a group of nurses, let's say. So it's important that this message is only worked on by the one user, so that way we don't have a duplication of efforts. So the user now has several options when handling that patient portal message. So first, they have the ability to accept the message, and then that will gray out the message for any of the other users in the distribution list within their inbox. They can now also release a previously accepted message. So let's say they're no longer able to work that message for whatever reason. They can release that, and then that will send that back, and then any other user in that distribution list can pick it up to continue working on it. A user can also reassign the message. So let's say, that patient, they're going to select who they think should be receiving that message, but they could select the wrong person. So that user who received the message can then go on and reassign that to the correct user. And then lastly, a user can also forward the message. So if the user received the message, but then feels that somebody else needs to be able to see it, so maybe they're not part of that distribution list, they can forward that to another user. Users can also attach comments to messages. So these comments can be used, to maybe in the process of working a message, update other users to what steps they're taking, or even for that user just to kind of, remember what they're doing with that message. And then that will be visible to that user and then any other user who can view the message in a new comments column that's in the inbox. Another enhancement is the ability to view the communication routing aliases in the from field when responding to a message. So basically, if that message was sent to a group of users, then when an individual user is responding back to that patient, it allows that patient to receive the response from the same group that they'd originally sent the message to. So it just creates a little bit of consistency. Okay, so in order to access these new functions, when you're handling these messages from a distribution list, the user can open the message and they'll see all those new, accept, release, reassign features. Or as you can see in that first screenshot, they can also right-click on the message, and then they'll see all those options listed there as well. With the upgrade, there are also new status icons. These can be viewed on the Clinical Tasking tab. And these icons will show the user whether the task is new, in progress, or completed. And you can see in those screenshots some examples of those new icons. Okay. In 591.841, we now have the ability to see both past and future appointments in the patient information bar. So this is just like you can currently see that in PM. So you would preview these appointments by hovering over that appointments badge. So you can see in this example. So those past appointments are going to be in gray, and the future appointments will be in blue. So this can be pretty beneficial when you want to be able to see, not only when that patient was last in the office, which can be helpful, but also if they already have any future visits scheduled. Okay, so the next enhancement that we're going to take a look at is the ability to access the medications module and immunizations from any tab of our assessment and plan template. So this is going to be very helpful to lessen the clicks for providers. So prior to this upgrade, if a provider was, let's say, entering an assessment in our assessment and plan template, and then they determined they wanted to prescribe a medication, they would have to leave this template, go to the medication module, prescribe the medication, and then they would have to come back into our assessment and plan template. So that amounted to a lot of extra clicks in the end. So now the provider can use, given my example, our medication link on any of these tabs, and a pop-up will open on top of our assessment and plan template, and that's going to have our medication module. So then the provider can go ahead, prescribe that medication like they normally would, and then once the provider closes that pop-up, it'll take them right back into the assessment and plan template, and they won't have lost their place, and they can just continue to document. Okay, so with 591841, the issue of not having certain patient demographic fields consistently documented between the EHR and PM is resolved. So an example of this issue that you might have had in the past was the marital status field. So prior to this upgrade, this field could be completed, in certain templates on the EHR side, but it wouldn't flow over to the PM side. So this could lead to some, inconsistent data or even duplicated efforts, if you're having to collect that information twice. So now when a user updates, in this example, the, marital status field in EHR, it's going to open our patient information window. So this is the same window that you see on the PM side. And then when the user makes those changes, this is actually going to communicate with the PM side, and that's just going to help make sure we have consistent documentation. So the next enhancement with this upgrade is the addition of a history summary panel. So you'll see this panel on both the intake and the SOAP templates. So I think this is a pretty cool feature. It was added to help lessen or even possibly eliminate the amount of time that a user has to spend going back and forth between, intake or SOAP templates and our history templates. So, just an example of how this, MOCA found this panel to be helpful was, let's say, provider's in a room with the patient and they're on their SOAP template, they're documenting, and the patient just happens to mention during conversation that they had, let's say, an appendectomy 2 years ago, but they never told the intake staff. So what the provider is able to do without having to even leave the SOAP template, they can look under that history summary tab, or panel, excuse me, and they can see, was that surgery documented? And if it wasn't, they can go ahead and add that surgery, and they never even had to leave the SOAP template. So another enhancement in regards to medical and surgical history for a patient is the ability to add an onset date when you're documenting that medical surgical history. So currently as it is, the user only has the ability to add an onset date. So this new addition of this onset age field will be very beneficial if a patient knows, for example, let's just say they had a hysterectomy when they were 52, but they're not sure of what that exact date of that surgery was. So instead of having, to go back, calculate what year that would have been, you can actually just enter that age in that onset age field. So you enter the age the patient mentioned, and the system will actually calculate that onset date for you, and then add it along with that medical and surgical history you're entering. So this is just really going to save the intake staff time, or whoever is documenting these histories, just save them a little bit of time instead of having to calculate the date themselves. So another enhancement on the histories template is the added ability to filter the medical, surgical, and interim histories grid. So when you're in that grid, you might have a long, extensive history for a patient, and maybe you're only interested in seeing the medical history or just the surgical history. So you now have the ability to select checkboxes. So they're going to be in the top right of that grid, as you can see in this screenshot. And you have the ability to view only the medical history, only the surgical history, only the interim history, or show all. So that default for this grid will be the show all, so you'll still see all of the patient's history by default. So the last enhancement as regards to our histories template is the ability to quickly add a diagnosis that isn't included in our medical surgical template. So this is found under the other option. So when I'm adding a diagnosis, the user has a few options now in order to find that appropriate code for that diagnosis. So the first is to just free type that diagnosis. So that will be in the blank box that's next to that other field. So just something to note that if a user is free typing their diagnosis, it won't be linked to a snowman code. Our second option is to click that magnifying glass. So that's to the right of our blank box. And that's going to pull up our diagnosis code lookup tool. And so this will, the user can search and it will return a diagnosis code, and that will be linked to a snowman code. And then the last option users have is to click the new details icon, and that's to the left of the blank field. So this is going to launch a pop-up, and that's going to allow the user to search for a disease or disorder, and that will be linked to a snowman code. So what I think is a pretty important enhancement that's going to come with 591.841 is the ability to mark encounters as sensitive. So this is pretty important because it's going to allow practices to have greater control over what patient data is being transmitted out of their EHR and with whom this information is being shared. So users now have the ability to mark specific encounters as sensitive, and therefore they can prevent their contents from being shared, so to any outside sources, to things like the patient portal. So these sensitive encounters are going to be highlighted, and this does include things like NextGen share referrals, and also when you're exporting data through Rosetta. So in order to flag an encounter as sensitive, the user, as long as they have the appropriate security rights, would go into our patient history toolbar, and they would find that encounter that they want to mark as sensitive. They would then right-click on that encounter. So once the user marks that as sensitive, they're going to have several options. So you can see in our second screenshot that user can select from several sensitivity settings. So some of the options are suppressing that data from automatically going to the patient portal, suppressing that information from outreach actions, and then you can also prevent that information from that specific encounter from printing on financial statements. So as you can see in the first screenshot, that our flagged encounters are going to be marked with a red exclamation point. So that sensitive encounter indicator, so that red exclamation point we mentioned, that's going to be visible a couple places throughout the EHR. So one of those is in our custom print and send feature, and also our categories view as well. So this is going to be really helpful, marking these as sensitive. An example that MOCA found this helpful is when dealing with situations where you have a patient, who's under the age of 18, and so you might have to deal with things like having a guardian that has access to the patient portal. So as I mentioned earlier, when you are sending referrals through NextGen Share, the user is actually going to be informed if there is sensitive material that's included in the specific encounter that they're attaching information from. So as you can see in that first screenshot, if I have selected an attachment and it's associated with a sensitive encounter, it's actually going to be labeled as that. So that way the user is aware that there's sensitive material, and then they can kind of maybe, question maybe if this should be sent out or not. Okay, so in 591.841, there is now the added ability for providers to designate certain documents that come through the PAQ as needing what's called multi-level sign-off. So this basically just means that it needs additional signatures from other providers before the document can be considered fully signed off. So now with this upgrade, providers have the ability to sign off on the document like they normally would in the PAQ, and simultaneously send it to the PAQ of any additional providers as well. So all signatures that are acquired through this process are going to display with the provider's names and credential at the end of the document, like the signature normally does. Once that document has been signed off by all the signees, the flag in the patient history toolbar is going to change to that blue check mark. So in order for a provider to add any additional signees to a document, what they would do is they would open their PAQ, find that particular document, and then that provider would use our sign off with actions feature. So you'll see in our screenshot that one of the new sign off actions that have been added is add additional signees. So this is going to actually launch a window once a provider runs their actions, and it's going to allow that original provider to either search or select from a list any of those additional signees that are necessary. So that original provider who added the signees will show as electronically signed next to their name and credentials at the bottom of the document. Any additional signees will show signature pending next to their names until they actually complete that sign-off process in their own PAQs. So any signee who receives that document will have the ability to reject the document. So, let's say, for example, there's any corrections that provider fields are needed. So that will require a rejection reason. And then that's going to send that document back to the original provider's PAQ along with their selected rejection reason. So when this comes back into that original provider's PAQ, it will come back as a pending document. And then if there were any signatures that had been acquired prior, those will be cleared out. Just as a note, any additional signees will not, however, have the ability to reassign the document or add any additional signees. And then if a designated signee is out of the office but has delegate set up, then that delegate will be able to sign off on this multi-sign document on their behalf from the PAQ. Okay, so the next enhancement was pretty highly requested. So with this new upgrade, the process of deactivating users and handling their pending tasks and PAQ items is now made much easier. So now a user can quickly reassign any pending tasks and PAQ items and also assign any delegates or reassign delegates all during the deactivation process. So when a user is deactivated in System Admin, a delegate check is performed by the system. So basically what that means is the system is looking to see, for this user, are there any pending tasks? Are there any pending PAQ items? It's looking to see if this particular user is the only member of any work groups. So obviously that could be an issue, if a task is coming in and they're the only one that's assigned to work those tasks. And then it's also going to check to see if that user is the only delegate for any other users. So obviously that could also be an issue. If they're the only delegate for a provider, then that provider, goes on vacation. You need to make sure there's someone else who's still able to, keep up with that PAQ or tasks or whatever they're a delegate for. So in that first screenshot, you'll see an example of what it would look like if, the delegate check was performed and there were pending, any pending items or any work group issues. So what you'll see is next to each line item, you'll see that blue resolve link. So what the user would do is they would click that resolve link, and then it's going to give the user the ability to, either reassign those pending items or to change the delegates. So once that user has resolved all those pending items, we'll see our summary screen and it'll show everything as resolved. And then that user is able to be deactivated. So if another user is assigned as a delegate for that deactivated user, they will actually see a status icon so in either their clinical tasking and or their PAQ tabs. And that basically just lets the user know that that user has been deactivated. So with the upgrade to 591841, there have been several patient portal specific enhancements. So the first enhancement that we're going to take a look at is our invitation-based enrollment. So this basically just eliminates the needs for tokens, and instead the patient can actually be enrolled and receive an email that contains a unique invitation link. So basically you can enroll your patient in the patient portal prior to their visit. And it just kind of allows the practice to be a little more proactive in gathering information. And it also will allow the practice to send forms for the patient to complete prior to the visit. So you can see in these screenshots we have, this is basically just an example of what the patient would receive. So if they were received the invitation-based enrollment email. Okay, so another new patient portal feature with this upgrade is a new version of our instant medical history. So this is referred to by NextGen as IMH Discrete, and IMH Discrete supports the direct input of patient data that's received from patients filling out forms in the patient portal. So basically these patient responses that are received, as a result of sending out these forms, they are mapped directly to various clinical templates. So what this is going to do is it's going to help you greatly reduce the amount of time that is spent having, a user manually review the information and potentially even have to enter it based on the information from these patient portal forms. So it is important to note that IMH Discrete is actually a third-party software. So it is integrated through NextGen, but I just want to make it known that it is a separate purchase. So you do have to purchase the software, and there's a license from the company called Primetime Medical Inc. So the instant medical history forms that are currently part of NextGen, prior to the upgrade, those will continue to be free. So as you can see in our screenshots here, users do have the ability to review the data that is coming through from these patient forms, and they can choose to omit any of that information as necessary. So the information from the patient portal forms, as I mentioned, they're going to be associated with specific fields in the clinical templates. So this is really going to save a lot of time, having to document some of the same information as opposed to just having the patient, fill it out in a form ahead of time. So this screenshot is an example of what they call the summary document. So this will be generated based on that patient data that's collected from any of those IMH Discrete patient portal forms that are sent out. So there have also been several enhancements to the online scheduling feature that currently exists in the patient portal. So just kind of the thought with these enhancements is that it's going to provide a more efficient and kind of an easier workflow for patients when they schedule an appointment. So one of the first things is that you can provide a link to your practice's website. So that's going to make it a little easier for patients just to be able to see some more information about your practice. And then I think this is a pretty cool new feature. It's no longer required that the patient has to actually log into the patient portal in order to schedule with your practice. So MOCA, really liked this feature. It's very beneficial when you're trying to attract new patients to your practice, because as you probably know, it's so important just to make it as easy as possible for new patients to schedule that first visit. The least amount of hurdles, the more likely they are to actually schedule that visit. So the online scheduling, it will also continue to support your existing patients as well, and it does integrate with practice management. So with this upgrade, there are several enhancements to the chronic condition workflow, and the hope behind that is that it will improve the usability. So in our current chronic condition workflow part of this upgrade, it requires the user to move in between several different templates, in order to review the findings, to document a current status, and then to place the orders. So with this new template, it kind of allows the users to review those previous findings, document current management plans, all from one place. This is really just going to eliminate those clicks that's required to complete a chronic condition visit. So our chronic conditions template was simplified. So they removed the plan details and renamed it to patient plan and provider plan. Users can now also open the diagnosis and AP history pop-up from within the template, so they added a button for that. So the user no longer has to go and open the assessment and plan template, which just saves a little bit of time, if they want to go back and, for instance, review those previous assessments. There's also now the added ability to place, view, and modify orders from our chronic conditions template. So they no longer have to go into, to like the My Plan or the Orders module to do those things. And there's also a new pop-up from within this template that allows the association of patients' medications to their problems. So the user no longer has to navigate back and forth through the medication module. So as you can see here in our example, we now have panels, and so that's going to allow us to do things like viewing the patient's assessments, their active medications, and that plan history. So that order panel is going to allow for the viewing, the addition, and the modification of patient orders without ever having to leave the template. And then as we mentioned, you can also associate those active medications for that patient to the appropriate chronic condition, all while staying in one template. So that concludes the new features that we're going to review as far as the EHR goes. So now we're going to take a look at some of the new features regarding the PM application that are found in the 591.841 upgrade. So in this upgrade, there are several enhancements. So, in regards to things like scheduling, demographics, and much more. Okay, so the first feature we're going to look at as far as PM goes is the new no-show and cancellation alerts. So prior to this upgrade, there was an alert for no-show and cancellations, but they were not separated in the alert. So the user really couldn't, determine what was a no-show and what was a cancellation. So now this practice alert is able to be customized. So it shows the amount of no-shows and cancellations for that patient on separate lines. So the user also has the ability to designate when these alerts will be generated. So let's say, for example, I want my users to see this alert after the patient has 3 no-shows within a 6-month period. So it gives you a little more flexibility. And then this also, so by allowing them to distinguish between a no-show and a cancellation, it just kind of helps to inform the practice because, as far as a patient not being able to make their appointment and calling or just no-showing, they're kind of 2 different situations. So with this upgrade, users now have the ability to schedule multiple appointments for patients in a group at the same time. So these patient groups are created. So you just basically create these groups with the appropriate patients, and then they're scheduled from one screen. This will create a separate appointment for each patient within the group. And these patient groups can be managed completely from within the PM application, so you don't have to go back to EHR. These group appointments can also be set as reoccurring. So let's say, for example, your practice offers classes that meet every Tuesday. You could create a group for the patients within that class, and then you can create a reoccurring appointment for every member of that group. So one of the major regulatory updates that came with 5984 that you're probably familiar with was the addition of our Shoji Fields. So those are the sexual orientation and gender identity fields. So as you probably know, those can contain very sensitive information, but they were displayed in several places throughout PM. So now there's an option to no longer display these fields. So this will affect things like the patient information window, the patient appointment lookup window, both the standard and the detail patient data sheets. So this is all controlled by settings within System Admin. So MOCA liked this because it just helps to, kind of ensure that this sensitive information is only being seen where it's truly clinically relevant to patient care. So another new feature with the upgrade helps with the handling of Medicare insurances. So this is a new alert that will appear when the user is attaching an insurance to an encounter in PM. If a patient is over 65 years of age and does not have Medicare or a Medicare replacement plan. So this will eliminate the alert for patients that are over the age of 65 and are covered under Medicare Advantage plans. So also in this upgrade, our history and non-history status reports have been combined into one report. So this is going to help users when they are identifying encounters that are in history status. Let's say they shouldn't be in history status because they have a non-zero balance, and also encounters that are in non-history status, but they really should be in history status because they have a zero balance. So users can also access the bounce control window and the patient's chart from within this report by selecting any of the encounters. So in 591841, there's now the added ability to automate prior authorization workflows. So this is done basically by submitting your prior auth transactions using RTS. So what it will do is it will verify with payers if they have a prior authorization on file for that specific patient. And then if they do, it's going to automatically populate the returned authorization number, those effective dates, and the number of uses. So MOCA really liked this feature because it's going to really help to greatly reduce that time that staff has to spend, on these prior authorizations.
All right. Well, thank you, Lexi, for all that information. It was great and super informative. Obviously, I think everyone can tell there's a lot of new features in this upgrade, some of which we aren't even mentioning. We really, like I said again, just wanted to hone in on those that our client found most beneficial starting day one. However, I did just want to jump in here and include some of the specialty-specific improvements for those of you who may be on the call, since, like I said, MOCA is a women's health group. We did not cover them in the main feature review. So first up is behavioral health. Now, NextGen really has done a lot for behavioral health recently, and they have mentioned that they will continue to do so, and this is one of their top focuses. We already did mention that group scheduling in the PM section, which I think will primarily benefit behavioral health practices, but they also included CCBHC indicators. These will actually flag encounters and locations as CCBHCs, and that's a certified community behavioral health clinic. This will basically minimize rejected claims from payers who actually require behavioral health charges to roll up onto one line on a claim regardless of diagnosis differences. So a CCBHC qualifying encounter option has been added to practice preferences encounters. And also, specific SIM codes can be flagged as CCBHC codes in the service items library. When a charge for one of those SIM codes is entered and saved, the encounter is going to be automatically flagged as a CCBHC qualifying encounter. Moving on here to dermatology, which has seen some pretty cool enhancements with the graphical exam tool. 204 new findings have been added to the out-of-the-box tool. Users also have the ability to configure get findings at the practice, location, or even provider level, which will allow you to show information pertinent to the provider and hopefully reduce documentation time. Users can easily document if pathology results were shared with patients or their PCP or even referring providers, and not only that, but actually how they were notified. And lastly, the dermatology quick exam template default will be added to the template default system to further enhance clinical content shipped with KBM templates. Next is ophthalmology. These updates we are especially excited for just from a documentation time-saving perspective. First off, there is the addition of risk indicators for macular degeneration and diabetic retinopathy. You're going to see two new icons. They're going to say AMD and DMRET, and also new fields on the risk factors pop-up. So to enter information into, this is really similar to the glaucoma indicator we have currently. And secondly, clinicians can now choose how to document for glasses and contact lenses using free text or the pick list and number pads that have been in place. So they can either click in the field for free text, which is what providers had requested, to then be able to use the tab key to navigate and quickly type in the number, then hit tab, the next number, then hit tab, and so on, which I think allows for much easier documentation, especially when you're working on a tablet in front of a patient. They can still use the blue arrow icon for a pick list and number pad if that's how they were used to doing so. And then lastly, cardiology had a pretty good amount of enhancements. We just included one here due to time constraints, but there are updates actually to the stroke risk assessment section. It's updated with what they call the CHAD2 prediction rules and additional new parameters added for predicting risks of stroke in defined patient groups, including recommended drug therapies. All right, so as I promised, I did say we would share with you all any issues we experienced with the 591.841 beta upgrade. Again, I already mentioned how smoothly the upgrade truly did go for MOCA, so there really only were a couple. The first issue was actually with patient pharmacy information. It is a known issue with severity of critical. What happens is when updating a patient's pharmacy on the Modify Patient Information window, it may actually lead to the patient information bar displaying out-of-date data in the pharmacy fields. So MOCA is experiencing this issue, and their current workaround is to view patients' current pharmacies from the Modify Patient Information pop-up or the Patient Demographics template. And this did impact all MOCA practices on day one of the upgrade go live. Next is certain service categories being wiped. This is also a known issue with the severity of critical. What happens is the categories tab on the patient history toolbar may appear empty when it actually contains data. This issue may occur when you select the categories tab after opening the patient record in EHR. MOCA is also experiencing this issue. Their current workaround is to refresh the category view on the patient history toolbar. It did impact MOCA day one of go live. However, I do want to point out it's sporadic and it's not affecting all practices. And even if it does affect one practice, it's not affecting all users in that practice. So the workaround, however, provided by NextGen is to actually uncheck the flattened category view in EHR user preferences. So you may experience that, you may not. It really is a toss-up. And lastly, there is a known issue when promoting a charge just accepted from EHR in charge entry in PM. It can remove one or more encounter diagnoses. Just want to point out here, this is not affecting MOCA at all. We just wanted to include it since we do know it's affecting some other NextGen users out there, just so you're aware and you can look out for this if you do plan on upgrading. So if you are wondering what your next steps should be, or if you have any other questions about our experience with the beta process or 591-841 in general, please let iTenif help. We can assess your current readiness. We can provide practice-specific recommendations for you, as well as help implement new processes and procedures. And if you want to learn more about us, please visit our website, itenif.com. Continue to sign up for these informative webinars, and also go ahead and check out our blog. We also have 3-day fixed-price on-site consultations for clinical workflow, revenue cycle, and front office, and also technology and performance. And of course, feel free to test drive our products as well. All right, well, we've made it to questions. We do have a good amount of time left. We wanted to make sure we had enough time so you guys could ask the questions and hopefully get some answers from our 591-841 experts. Lexi and Adam are here to answer those. But thank you all for everyone for joining us today. I'm going to go ahead and turn it back over to Chelsea.
Great. Thank you so much, Lindsay, and thank you, Lexi, as well. And Adam has been on the sidelines helping with questions, so Adam, thank you. I did want to say that we will be sending out a copy of the presentation along with a link to the recording later this week. So check your email for that. If you don't receive it by the end of the week, check your spam box. We've been having an issue lately where our automatic emails are going there. And if you don't get them, you see everybody's information up on the screen. Feel free to reply to or email any of those people requesting them, and we'll make sure that you get them as soon as we get them uploaded onto our website. Okay, so starting at the top. Will medication hyperlinks be on the OPH assessment plan template? Adam, do you want to take that?
Yes, I can take that. Yeah, so with the OPH assessment plan template, that does not have the active text hyperlink for medications and immunizations. The new enhancement that NextGen put in is really for other specialties to document their assessment and plan. They actually have to go to a separate pop-up, meaning they could not get to the patient on the patient history toolbar to get to the medication or immunization module. So for ophthalmology, that assessment plan template is a little different than other specialties, so that one will stay the same.
Thanks, Adam. Next question. When the demographics are changed on the EHR side, does the change show on the Histories tab indicating when and who made the change?
Yes, I can take that one as well. So yes, any demographics change in EHR, it would be the same as how it does in practice management. It would all be recorded to show this is what the change was and who made the change in the practice.
Perfect. Thank you. Next question. What type of documents would require multi-level sign-off?
Yeah, and I can take that one as well. So this one, it would really vary depending on your practice and your policies and what specialty you are. Any document that is generated directly in NextGen that it can be set up to either be single sign-off or multi-sign-off. It just depends on what your practice and policies are. So we don't really have like a list of quote-unquote documents that would require it. It really just depends on your workflow.
Perfect. Thank you, Adam. Next question. For invitation-based enrollment, what phone number is NextMD looking for the patient to enter? Home, work, cell, or alt? Or does it allow users or the use of any of those numbers on file?
Yeah, so I can take that one as well. So with Maternal Ohio Clinical Associates, they are using the home phone number. It's a required field, and it's the first defaulted field for phone number. That's what we're seeing with them. So the other phone number that was documented on patient charts isn't pulling, so it should be just the home phone number. But that is, unless Lexi has anything else to add.
No, yes, that's what we're seeing, is just that home number field.
Perfect. Thanks, guys. Next question. Could you touch on patient portal as all settings would be set back to ground zero? Adam, can you touch on that one?
Yeah, and that one, so when we did not experience any of the patient portal settings being reset, there are a few new email notifications that are in with this upgrade. So you will want to definitely go through the settings and just verify, especially we did have to go through and recustomize some of the HTML and the text for some of the new message types. but we did not see any of the settings get reset.
Perfect. That's what I like to hear. Next question. I know that we had already answered this one in the chat, but it looks like there's a follow-up question, so I'm just going to read the whole thing. Does the online scheduling with the portal require the patient to be enrolled in the portal even though they don't have to log on?
Yes, I can take this one also. So with this, there is some configuration that you can put onto your practice's website that will integrate directly with NextGen, that the patient would actually go to the site, put their information, search for the appointment, and all of that. If it doesn't pull any information back from the database, then meaning that either they don't have the same address or phone number or name as what's documented in NextGen, they would have to then go to the portal to log on and schedule online, knowing that for the most part, anyone that has patient portal is already enrolled, obviously, but with the new, you could also use the new invitation-based enrollment. So if someone was having issues, you could invite them to the patient portal, even though they're not a current person in your practice, but you could invite them even though they've never been seen and then schedule through the portal.
And then there was a follow-up to that, Adam, saying, so if it pulls the patient up, they don't need to be a portal member?
Correct. Yeah. If when the patient is going through and they put their information and it returns a finding of their information, yeah, they would not have to go to the portal. It would then send.
Okay, perfect. And it looks like this might be the last question. So if you have questions, feel free to ask them because we still have a few more minutes that we'll be able to answer them. And Lindsay, maybe this one's for you. Will there be a specialty-specific WebEx available, specifically ophthalmology? Any idea if there's any current plans for that, Lindsay?
I don't think we have any current plans for it as of right now, but again, like I said, we love to hear your guys' ideas for any webinar topics. We're really just trying to put these together for you guys to attend and get some education out of it. So I will go ahead and jot that down and bring that back, and hopefully we can get something put together that focuses really on the specialty updates for this upgrade.
And I also want to add that, if you do have specialty-specific questions, we're here to help, so feel free to reach out to us and we'll see what we can find and what information we might be able to pull together for you. It looks like we got more questions, so way to go, guys. With the prior authorization upgrades, will this include prescription authorizations?
All right. Yeah, I can take this one. Yeah, there are definitely some upgrades with authorizations in the PM workflow. Specifically with the medications, we'll have to do a little more. We'll have to look into it a little more, and we can definitely follow up with you on that specific answer. Just with the medication specifically, we want to just verify.
Okay, perfect. I will flag that one for follow-up, and we'll reach out to you separately after this webinar once we have some time to get you a solid answer on that one. Next question, can the invitation-based patient portal send in mass?
Okay, so by default, there's not a built-in functionality to do a mass invite. Though I tend to have gone through and worked with Maternal Highway and a lot of our other clients to set up custom scripting. So that's definitely something that we could look into with you, but that's not built into the base functionality of the auto-enroll or the invitation-based enrollment.
Thanks, Adam. And it looks like there's a follow-up to that as well. Also, NextGen had a problem with mass emails. Was it corrected in this version?
Yeah, I can take that one also. So we use the mass email to everyone within that uses patient portal and is enrolled. We've used that in prior versions and in this version as well. So we would need just like a little more detail on what issues, and it could be So I'm not really sure what issues you're experiencing with the mass emails, but we definitely take advantage of that for a multitude of different things, whether it's a provider leaving, it's the office has to be shut down for an emergency or something like that. So we would need just a little more information on what issues you're experiencing.
Yes, that'd probably be a good one. You see Adam's information up there. You can feel free to reach out to Adam, and we'll see what information we might be able to get for you in regards to your circumstances. Okay, and it looks like we are at our last question. Does the upgrade contain the bidirectional immunization fixes for the CHRIP registry? NextGen told us it was in 591.
All right, yeah, I'll take that one. That one, we would have to look at the specific interface. I know that with these upgrades, there's always things that are touched in the interfaces within Rosetta and all of that. So that's definitely something we could look at and test that functionality with you just to be sure. But we would need to kind of review that a little more in depth.
Perfect. So we can follow up with you on this one as well. Well, everybody, thank you so much for joining us today. It looks like we ran a couple minutes over. I apologize for that, but I hope that we got your questions answered. And if we didn't, again, feel free to reach out to us. We're here to help. We love questions. So just shoot us an email or send us a call, and we'll be in touch with you. Adam, Lexi, Lindsay, thank you all so much for contributing to this. I know this one took a lot of work to pull together. So everybody have a great week, and we hope to see you at our next webinar in July.
Thank you, everyone.
Thank you.